Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and I am here once again in the 90210 with my associate and amazing co-host, Dr. Millicent Rovelo.
Good evening. You didn't mention how glittery and sparkly I am.
I did notice that you're glittery. Did you bump into a pixie, or did you?
I did something. I'm
hit a unicorn or
in
something?
Glitter. I don't know what I stepped in, but
You're very sparkly.
I'm very sparkly today.
I noticed that. I was like, it's very, very sparkly. It's a good thing that you're sparkling, because I think this is something you probably do more than I do, that we're going to talk about today, which is removal of breast implants without replacement.
Yes.
And what the options are.
Yes. So we definitely see this. So this is patients that have had implants in for anywhere from 2 to 30, 40 years. And for whatever reason, they've decided they want to remove their implants and they do not want to replace them. And so for whatever reason, they're sick of their implants. And most people come and they say, what happens if I don't replace my implants? What are my breasts going to look like? And that can run a whole range of outcomes, and it really depends on what kind of breast they have remaining.
It's true. It can be very variable.
Very variable. And so let's start. So when you have implants in for any length of time, it's going to stretch the skin out to any amount, because that's what it does. It's an implant and it stretches the skin. When you very quickly remove that implant, you are now left with extra skin. So even if before, when you had the implants, it didn't look like you had extra skin or that your nipple was sitting in a lower position than it should, once that implant comes out, you will notice that you have extra skin, that the nipple is sitting lower than you would want it to sit, and you're probably going to need some kind of lift. The one patient population that I have where I highly recommend against removal and not replacing is the thin patient with very little breast tissue.
Oh, yeah. No, that's a disaster.
That is a disaster.
Yep.
If that patient who had very little breast tissue to start out with still has very little breast tissue, if they remove their implant, even if they do a lift, if they remove their implant and don't replace it, they will have a very deformed looking breast. The skin, which is so thin, it's basically just going to crinkle in and stick to the chest wall and leave a very unaesthetic looking breast, if it even resembles a breast. Now, if someone has fairly large breasts to start, maybe they were a C, D cup, they still have a decent amount of breast tissue, even